And I'm Teresa Snyder. I'm a dietitian here at the Cardiac Rehab Program. And this presentation was developed by Nancy McCaffrey, who's our other dietitian, and myself. And you've probably met with me or her already. If not, you probably will be. We also will meet with you on an individual basis and kind of talk about what you need individually for yourself to help your heart health. So we're going to talk about risk factors a little bit, and mostly the diet-related risk factors for heart disease. Smoking, of course, is a huge risk factor, not really diet-related, but that's one of the big things that people can do in their lifestyle to decrease their risk for heart disease or recurring heart problems. Physical inactivity, another risk factor. And then these three, being overweight, high blood pressure, and high blood lipids, are to some degree nutrition-related and diet-related. And when I talk about diet, I'm talking about the whole of the foods you eat, not going on a diet. I'm talking about your diet is the way you eat. So when we talk about the physical inactivity and weight, what you eat and how active you are do affect your weight. So how many calories you take in means whether you are staying at a stable weight and how active you are. So what you take in and what you put out results in either staying at your same weight or gaining weight if you're taking in more than you're burning, or losing weight if you're burning more than you're taking in. That's very simply put, but that's the equation. We know a lot of other things come into play there, but that's the simple equation. So simply, if you decrease food intake by 300 to 500 calories a day, that would, in theory, allow you to lose about a pound a week of body weight, and it would be mostly body fat. So a 500 calorie a day deficit in your calorie intake would mean you would be losing weight, and about at a good slow rate of about 1 pound a week. You don't want to be losing weight drastically if you're trying to lose weight. And also on the output side, increasing activity to use more energy so that you're burning more. If you're going a mile, so if you're walking it or running it, you're going to burn about 100 calories on average. So whether you walk it or run it, you're going to burn about 100 calories per mile. It just takes longer to walk it than run it, but it's going to be about the same when you're done. So if you look at just 100 calories, so just 1 mile, adding 1 mile a day, gained or lost can translate into 10 pounds in a year. So if you're having 100 extra calories a year or burning 100 calories less, or vice versa, you're burning 100 calories more a day or eating 100 calories less a day, that translates, with no other changes, that translates into about 10 pounds. So you can see how we slowly gain weight over the years because it's very easy to eat 100 extra calories a day, right? That's very little. So eating less, moving more, if for you, weight loss is one of the things that would help with your heart health. And when we talk about diet, I did mention that when I use the word diet, that is the way you eat or your style of eating rather than going on a diet, because that diet mentality, we have found over the years, many studies and people's just accounts of diets they've been on, and that those don't really work, do they, in the long run? People lose weight by whatever means, cabbage soup diet. Has anyone ever heard of that or tried that, cabbage soup? There's the Atkins, where you're eating all kinds of meat and eggs and cheese and losing weight very well. But I do know whatever means, when people do that, they tend to gain weight back, and a lot of times will gain more back than what they started out with. Because those kinds of things aren't maintainable. So you want to not think about going on a diet, but thinking about eating in a healthy way. Okay, and if needing to cut back a little bit to cut down on calories, that's something to think about. But it's a lifestyle. It's not a temporary thing that you would go on this diet, lose this weight, and then you're done with it, because you know that doesn't work. So it would be a lifelong thing. Just like eating for heart health. You're not going to eat for heart health for a couple months and then stop, right? Because that's not going to do you any good in the long run. And then thinking about foods as all foods fitting into a healthful diet. There's no good foods or bad foods. What would be a food you'd consider not very heart healthy?
What food would be heart healthy? I guess fats.
Like sausage. Okay, but sausage is a good example. Sausage in itself isn't a bad food, but if you eat a lot of it every day, it's not going to do your heart any good. It's going to help your arteries to get clogged. So it's not going to help your heart or your arteries. But if you ate sausage once a week, a small amount, or once a month, it's not really going to do any harm. So it's not that the food is bad or good. It's how often you eat it, how often you eat certain foods. And you want to eat more of the ones that are going to, and have 90% of your diet be those foods that are going to be helpful for your heart, and then the small things that maybe in excess would not be helpful for your heart, but in small amounts are going to be okay. Okay, so losing weight, again, it simply is calories in and calories out, but there's a lot more to it, as you know, if you've ever tried to lose weight and keep weight off. And there's emotional eating, there's eating for different reasons, there's we're surrounded by food that isn't necessarily the most wholesome and healthy for us, so it's easy to eat a lot of high-calorie food that doesn't give us much nutrition. But when you're trying to lose weight, you really want to think about how much you're eating, be conscious of how much you're eating, if you're eating because you're hungry, or if you're eating for another reason, like boredom, or you're feeling sad, or stressed. People eat for a number of different reasons. So thinking about why you're eating, and when you are eating for hunger, stopping when you're satisfied, not getting overly full. Thanksgiving's not too far away, and we know what we do on Thanksgiving. Well, you don't want to be doing that every day. On Thanksgiving, you eat till you can hardly move. Most of us, I do too. So, but you don't want that feeling all the time. You want to be eating till you know you've had something to eat, but you're not feeling that uncomfortable, full feeling. Creating a plan can help if you are trying to lose weight, to make any diet changes, but to lose weight. Keeping a daily record helps many people, because it really helps you see what you're eating and what amounts you're eating, because when you're keeping a daily record, you're thinking about it, right? You're mindful of it. Writing plans for what you're going to eat and shopping for that food to make that food. So that leads to less impulse buying and buying foods that are going to be high-calorie convenience foods, or things that aren't really going to help, that you're buying when you're famished and you're looking for a quick fix. And then when you're getting ready to eat, asking yourself if you're hungry. Okay, now, a lot of people skip breakfast because they say they're not hungry in the morning. And I do advocate eating breakfast. I think it's important to eat breakfast. We get a lot of if you're eating a high-fiber cereal, we get a lot of our fiber in the morning, a lot of our day's worth of fiber during breakfast. Also, people that are trying to lose weight, they have shown in studies that skipping breakfast does not help. So skipping meals does not help weight loss. You'd think that it would, because you think you would eat fewer calories throughout the day if you're skipping a meal, but you make up for it and then some, because you get very hungry. So you want to keep that fire burning by having food throughout the day, at least breakfast, lunch, and dinner, and maybe a snack or so. So when I'm saying ask yourself if you're hungry, if you're one of these people who has never eaten breakfast and gets up and is not hungry, do try to eat something even though you're not hungry. But when you're just, if you're walking by the candy dish at work or at someone's house and you're not really hungry, but it's there, that's when you want to ask yourself, do I really want this? Am I really hungry? And then identify when you're overeating and why. So patterns of overeating and seeing if you can change those patterns. So it sounds simple. It's not simple. If you've ever tried to lose weight and keep it off, you know that it's not simple. But these are some things that can help for awareness. Okay, so high blood pressure, another risk factor for heart disease, and that is diet-related. So it is associated with weight also. Weight affects your blood pressure. Activity level affects your blood pressure. What you eat affects your blood pressure. So what we're shooting for is the 120/80, or less than that. So that's the optimal level. And so if you have hypertension, you're hopefully working with your doctor and medication and lifestyle changes to come to a blood pressure that's right for you. But this is the optimal for most people, is the 120/80. I wanted to tell you about some studies. Has anyone ever heard of the DASH studies? DASH stands for Dietary Approaches to Stop Hypertension, and those were very large, well-done studies that showed that the way people eat can indeed affect blood pressure, and following a certain style of eating lowered people's blood pressure. And we know that sodium affects blood pressure. Too much sodium raises blood pressure. So when they follow this style of eating and also cut down on sodium, blood pressure dropped even further. So this is a good heart-healthy way to eat if you're trying to think about changes that you want to make your diet and yourself and your arteries healthier. This would be a good way to go. And what they did find, and I'll show you what that consisted of in a minute, but what they found was that it did reduce blood pressure, and the blood pressure reductions occurred pretty quickly within about 2 weeks. And when, as I said, when they limited sodium to less than 2,300 milligrams a day, they had even better results with the blood pressure. And 2,300 milligrams a day is about what's in a teaspoon of salt. Okay. But we do get most of our sodium from other foods, not most of us, from packaged and processed foods rather than the salt we put on foods.
What's the recommended daily allowance?
It's 2,300 or 2,400, yeah. A lot of experts are recommending less than that, like 2,000. For certain health problems, 2,000 and even 1,500 is actually ideal. But 1,500 for most people is hard to do because we eat a lot of, yeah. And these foods I have here, I'm going to perhaps show you some examples of some foods, but these are all packaged foods, and so the very best way that you can eat is as few packages as possible. But I couldn't bring. I could have brought a bag of beans in, I guess. But so you do want to think about how you can limit the sodium by eating simpler foods. But these DASH studies. This is what and this is in your handout that I gave you also. This is what it consisted of for the food choices every day. So they were choosing in the higher ends of the counts here were for the higher calorie level. So it really depends on how many calories you need. And the higher end was about 2,000 calories a day, which is appropriate for most men. Women usually need less than that. So lots of fruits and vegetables, 4 to 5 cups a day of fruits and vegetables. And so more than what most people generally eat. And when what Nancy and I recommend is eating 3 cups of veggies a day and 2 cups of fruit. So trying to meet those goals. And a cup of fruit is an apple or a banana, an orange. That's about a cup. Low-fat or fat-free dairy foods, so 2 to 3 cups a day of those. So either low-fat, so 1% or fat-free milk, fat-free or low-fat yogurt make up those dairy foods. 6 to 8 ounces of whole grain products, so 100% whole grain stuff. So now these have a lot of sodium in them, but they're whole wheat. Like these are like Triscuit crackers. These are whole grain. So all of these things here are whole grains. So you know, whole wheat pastas, rices. You can buy brown rice. There's couscous they make now that is a little tiny pasta that's whole wheat. There's some novel grains that like quinoa that are starting to become more available. And things like your taco shells. If you're having tacos, look at brands, different brands, or use just corn tortillas and make soft tacos. You know, so there's ways to get whole grain and not a lot of sodium. These only have 5 milligrams per 2 shells. So you have to, if you're buying packaged foods, comparison shop for the most whole grain and the least amount of sodium.
8 ounces is half a cup?
Yes. No, I'm sorry. Half a cup is 4 ounces if you're talking about like a measuring cup. This is 16 ounces, so 4 ounces is about here. Okay. So the dairy, the whole grains. Oh, and I'm sorry, and with the whole grains, you were asking in reference to the whole grains. The whole grains, it varies a little bit. It could range from half a cup of cooked cereal. That's an ounce. Or a piece of bread is an ounce in general. A whole cup of dry cereal is an ounce. So they vary because they're different weights. So this would depend on what grain you're eating. So meat, so 3 to 6 ounces of meat, poultry, or fish. So 2 decks of cards a day of meat, poultry, or fish. This is 3 ounces of meat. Okay, and it would be something like, if it were a chicken breast, it would be about that big. If it were a hamburger, it would be about this size. Or roast beef or pot roast would be about 3 little slices. Okay, so less than what a lot of people eat currently in terms of their animal protein. And then 4 to 5 servings a week of nuts, seeds, and dried beans, but dried cooked beans. So, and the servings are here and listed in your packet of those foods. So those foods are several times a week, a combination of those foods. So what these food choices give you are certain things that can help your blood pressure. So the fruits and vegetables give you a lot of potassium, which we know is helpful for keeping your blood pressure lower. The dairy has calcium and vitamin D, which we know help your blood pressure. The whole grains and these nuts and seeds and beans, magnesium, which helps your blood pressure. So, and then the lean meats, poultry, or fish for protein intake. So this is more of a don't go way over that. So very heart healthy, and the goal of this was to see if it lowered blood pressure, and it did. So not only is it helpful for your arteries in terms of lowering your cholesterol, because this is a heart healthy way of eating for your cholesterol too, but also can help blood pressure. So like I said, even without the sodium restriction, they did lower blood pressure. If you are looking at sodium intake, trying to limit it, and you asked that question earlier, to about 2,300 milligrams a day, and that's about 700 to 800 milligrams per meal. So, you know, I like to try to stick to 600 or less, which equals 1,800 a day milligrams, and then you have a little bit of room for snacks and stuff. So think about, you know, somewhere in that general ballpark in terms of sodium. And that helps in looking at some kind of packaged foods where you might be getting 1,100 milligrams from one frozen dinner, or if you go to a fast food restaurant, one burger has 12 or 1,300 milligrams. So you know that you're going to go over for the day if you eat that, right? So if you were going to eat something high in sodium, you'd want to look at the rest of your day and keep the sodium very low the rest of the day. So meaning, fresh foods, fresh fruits and vegetables, and fresh meat, fish and poultry, grains without anything, not prepackaged grains. All those things are low in sodium. So if you eat a lot of those foods, that will keep the sodium down. And flavor it with, you could use a little bit of salt, but flavor it with herbs and spices so that you don't have to use a lot of salt. So the package, as I said, the packaged and prepared foods is where you find most of it. So you really, any packaged food you're buying or anything that is pre-prepared, you really want to be cognizant of, whether that has a lot of sodium in it. Packaged foods are relatively easy because you can read the label. But if you're going out to eat or you're buying something from a vendor that doesn't have a food label there, you have to kind of be, know what types of things have a lot of sodium in them. And in your packet, I've included a list of foods that typically are high in sodium, and those are listed here. So I'm not going to go through these step by step, but as you see, mostly processed and fast foods. So ways when you're cooking to flavor foods without adding a lot of sodium. Trying, like I said, herbs and spices, fresh or dried. Lemon, lime, wine, and vinegar add a lot of flavor to things. So try those. Try marinades with animal protein. There's a lot of different flavored vinegars out. There's balsamic vinegar. There's a lot of ways you can flavor without using a lot of salt. Trying spiced mixtures like Mrs. Dash. There's a lot of varieties of those, and finding a few that you like to sprinkle on things instead of using a lot of salt. Okay, so lipids, high blood lipids, those are your cholesterol numbers, basically. That consists of those, your total cholesterol, what they look at when you get your cholesterol tested, your blood lipids tested. They look at your total cholesterol, your HDL, your LDL, and your triglycerides. Those are the things that they check. So first talking about cholesterol. Cholesterol is a substance that it's found in our bodies. We make it. Our bodies make it. Especially it's concentrated in certain areas, but we do have it in every cell in our body, but certain areas have more, like our brain and liver and kidney. And we also get it from the food we eat. So you make it and you also eat it. If you do not eat any animal products, so you eat no dairy and no meats, fish, poultry, you do not eat any cholesterol, because plants do not have cholesterol in them. Okay, but you still have cholesterol because you make it. So a lot of the cholesterol that we have in our bodies we make, and then the rest we eat. Okay. Oops. So the total cholesterol that they look for when the doctor checks it is 200. Oops. Okay. As I said, it's in every cell. It also, we do need cholesterol. So cholesterol is not a bad thing. We need cholesterol for our cells to function. It also makes some hormones, like some of them are, testosterone is made from cholesterol. Cholesterol is a precursor for the vitamin D we make in our bodies. We need cholesterol to digest fat because one of the things that is made from cholesterol is bile. Your liver makes bile out of some of the cholesterol, and that's stored in your gallbladder. I forgot which side your gallbladder's on, but stored in your gallbladder. And when you eat fat, the gallbladder secretes some bile out, so it helps you digest the fat. So it would be hard to digest fat without that bile. So the bile helps you digest fat, and your lipoproteins are going to carry the cholesterol. That's why they're called HDL and LDL. It's based on how much cholesterol those lipoproteins carry, actually. So, but kind of complicated. But just to know that the HDL you want to be high and the LDL you want to be low. And the reason is that the HDL, what it does is it kind of picks up cholesterol around your body and brings it back to your liver, and your liver gets rid of it. So if you've got a good high HDL, it's helping to clear some of that cloggy stuff out of your arteries, okay, the stuff that's going to clog your arteries eventually. So one of the things the liver does with it is make bile to digest foods, but it also just gets rid of it. So HDL you want to be at least greater than 40, and the higher the better for your HDL. What raises HDL? If you're a smoker and you quit smoking, your HDL will probably go up. Exercise, if you start exercising more, your HDL will probably go up. If you lose weight, your HDL will go up. Alcohol can potentially raise HDL, so I'm not telling you to go out and start drinking if you don't drink alcohol, but you want to, if you are drinking a moderate amount, and by moderate, it's for men 5 to 10 ounces of wine a day. For women, it's 5 ounces a day. More than that has not shown to be beneficial. So if you're drinking that amount and you talk to your doctor about it and it's not interacting with any of the medications you take and not causing any ill effects, then it may be helping your HDL get higher. So alcohol is kind of a double-edged sword. There can be negative effects to alcohol, but it also may be something that can help your heart in that it can raise HDL. And that's any alcohol. It's not just wine. So it's also hard alcohol. 1.5 ounce is a serving of hard alcohol. And beer also is including that, a 12-ounce beer. Those are all a serving. And omega-3 fats, what you get in fish, those good fats in the fish, that can raise your HDL. Oops. So your LDL is what's called the bad cholesterol, because your LDL is when that's high, when you've got a lot of that around, that can get stuck in your artery walls anywhere, not just in your heart arteries, but anywhere. That's where peripheral artery disease, the cause of that, and also when people have plaques in their arteries that go to their brain. So the cholesterol can get kind of stuck there and build up there, and that starts a chain of events that can cause a plaque to form, and then that can cause a blocked artery. The whole chain of events can happen that will eventually cause a blocked artery, and that would be either chest pain or heart attack. Oops. Sorry about that. Okay. So this is how it begins, and then our body tries to kind of deal with that cholesterol buildup, and by doing that, it actually makes the plaque bigger, and eventually it's going to squeeze off the artery. Or the other thing that can happen is a clot can form on there, and the clot can actually block the artery or break off and block something somewhere else. So for your bad cholesterol, optimal level is less than 100 for a lot of people. But if you have had a heart attack or a bypass surgery or a stent, any cardiac event, the doctor usually is trying to get your LDL cholesterol down to 70, which is pretty low. But that's where they have found is the most protective against future things happening. So what lowers your LDL? What's helpful for LDL? Following low-fat diet, but not real low-fat, but low in amounts of saturated and trans fat. So the fats that you do eat, you want to be more of the plant fats, polyunsaturated fats, and monounsaturated fats, which I'll talk about, rather than a diet high in animal fats, which have a lot of saturated fat in them. So saturated fats come from full-fat dairy products, meats. So watching how much you're eating of those and buying lean meats and low-fat or fat-free dairy you will get rid of a lot of the saturated fat. The trans fat is made. It's not made in great quantities naturally in the world at all. But when we take a liquid oil like soybean oil and make it solid, what they started doing was thinking that it was more heart healthy years and years ago to take the vegetable oil, and so instead of using butter or lard, using this solid vegetable oil. But in that process of making it solid, it changed the structure of it so it acted like saturated fat in your body. So they found in more recent years that trans fat, as it's called, is actually as bad for you in terms of clogging arteries in your body and raising cholesterol as saturated fat. And the other thing that trans fat can do is lower your HDL a small degree. So you really don't want that. You want your HDL to be high. So in some ways it's almost worse than saturated fat. Losing weight and exercising more, that seems to be a common theme for everything, lowers LDL. More fiber, especially soluble fiber, so the type that's found in oats, oatmeal, and beans, and barley, and apples, that's all soluble fiber, so that helps to get rid of some of your cholesterol, so it helps lower cholesterol. These beans, by the way, Eden makes canned beans that have no added salt. First I've ever seen, only company I've ever seen that makes no added salt beans. It's Eden, E-D-E-N, organic. They have, half a cup has 15 milligrams of sodium, whereas half a cup of regular beans, canned beans, has 460 milligrams. So if you look for those products, you can find them if you want some convenience products that have lower sodium. They are usually more expensive. So beans, soluble fiber. Beans are a great food. I encourage you to eat them every day if you want. Start slowly, though. Get a lot of gas if you eat a lot of beans all of a sudden. You'll be a little bit uncomfortable. And then there's specialty margarine spreads made with these things that are called plant stanols or plant sterols. And those are the, has anyone ever seen Take Control? And then Benecol is another one. These actually help lower your cholesterol, actively help lower your cholesterol, these plant things that they put in it. So if, and they are a little more expensive than regular margarine, but if you want to be even more active in lowering your cholesterol, this is one of the things that can do it, along with a heart-healthy way of eating. It's not a necessity, but it can be one more thing that can help lower cholesterol. Okay, so triglycerides are the third thing that the doctor looks at, and those come from food we eat. When we eat fat, it's in the form of triglyceride. So we eat it. We also do make some of it. So that floats around in our blood, and that can raise your risk for heart disease as well. And what the doctor looks for when they test your triglyceride is less than 150, okay, in your blood. And so when we find that you have a high level of triglycerides, you look at how much fat you're eating overall, especially the animal fats, the saturated fat and the trans fat, because that raises triglycerides also. Also, again, the weight loss and more exercise, that can help lower triglycerides. More fish oils can help lower triglycerides. So fish oil, eating more fish is a really good thing, not deep-fried filet of fish sandwiches, but fish that's cooked in a way that doesn't add any trans fat or saturated fat. So the recommendation is for fish is to eat, for people without heart disease, so clogged arteries, the recommendation is to have about 6 to 8 ounces a week to get a good amount of the fish oils. For people who have heart disease, I would actually double that. So that's a lot of fish to eat. So that's about 12 ounces a week of fish. So a lot of people aren't there with their fish intake. So if you have heart disease and you're not eating a lot of fish, I would recommend talking to your doctor about taking a fish oil supplement. A lot of times the doctor will actually prescribe that for you, but that is a very helpful thing to do. We know that the current science, there's a lot of evidence that says that it will help protect your heart in the future if you have heart disease already. So think about that if you're not eating a lot of fish and not taking a fish oil supplement. And other things that can help triglycerides are lowering the amounts of sugar that you eat, because sugar can raise your triglycerides. So if you're a person who has a real sweet tooth and eats a lot of added sugars or drinks a lot of sodas or anything like that, and you have high triglycerides, you want to think about reducing that. And that's a good idea anyway, to not have a lot of added sugar, but especially if your triglycerides are high. And then alcohol, where I said alcohol can raise your HDL, so that's a good thing. It also can raise your triglycerides, so that's not a good thing. So you have to see, if you do drink alcohol, see how your body responds to it. And again, make sure it's okay for you. It's really an individualized thing, the alcohol, because some people are affected one way and some people another way. And also you have to look at what medications you're taking and make sure that there's no serious interactions there. So, in summary, all of these things, losing weight, exercising, quitting smoking, and then diet-related, the eating less saturated fat, eating a lot of fiber, and including omega-3 fats, so by fish or by eating fish or by taking fish oil supplements, or a combination of those. And when I talk about lowering the saturated fat and the trans fat, what you want to replace those things with is the monounsaturated and the polyunsaturated. And in that polyunsaturated is the omega-3 fats. And again, the saturated fat is going to come from mostly meats, so mostly animal sources, and dairy. Cheese is a big one. Cheese, I find in my patient counseling that people look at the amounts of meats that they eat, and they try to buy lean meats and eat more fish and poultry, but they really like cheese, and a lot of people eat a lot of cheese. So if you're a person who eats a great deal of cheese and puts cheese on a lot of things and adds it to a lot of dishes, you want to think about lowering that amount of cheese. And the reason is that cheese has some benefits. It's high in protein, it's got some calcium, but it's very high in saturated fat, and a very small amount has a great deal of saturated fat. And then really the only plant fats that have a lot of saturated fat in them are the tropical oils, so palm oil, coconut oil. So where you usually find those things are in these foods, the coffee creamers, the Cool Whip, coatings on candy, and different candy bars. So you want to make sure you're looking, limiting these foods, because these are foods that give you a lot of calories and not much in the way of nutrition anyway. But this is where you're going to find a lot of those tropical oils. So saturated fat, to think about a number, when I said cheese has a lot of saturated fat, well, what does that mean? What's a lot? What do you need a day? So the recommendation is to get less than 7% of your total calories from saturated fat. What that translates to in terms of calories, if you're a woman, most women need anywhere between 1,500 to 1,800 calories a day. That translates into about 10 grams of saturated fat a day. So if I eat this piece of cheese, I have 6 already. So that's why if I eat 2 pieces of cheese a day, I'm already over that saturated fat budget. And so for men, most men can have a little more, because men usually need more calories than women. So they're at about 15 grams. So still, if I eat 2 pieces of cheese, that's 12 grams. I'm almost there if I'm a guy, too. So that's why you really have to be careful about the animal stuff. Cheese and anything made from an animal, be careful about how much you're eating. Butter, I love butter. It tastes great. But a tablespoon of butter has 7 grams of saturated fat. So, eat a tablespoon of butter a day, and you're kind of done for the day. You need to eat all plants the rest of the day because you're going to go over. A half cup, or I think it's a cup of premium ice cream, like Haagen-Dazs or Ben & Jerry's, has over 20 grams of saturated fat. So you really have to be careful about what you're eating, because it's very easy to go over that. So just trying to count that is beneficial. And in the other class, I talk about just doing 2 things and keeping that saturated fat to 10 to 15 grams a day, and trying to get your fiber up to about 25 to 30 grams a day. So doing those 2 things can be very helpful, because that means you're going to be eating less of the full-fat dairy and meats and fatty animal fats, and more of the things that have a lot of fiber, like beans and whole grains and fruits and vegetables. So that'll be a positive switch. So limiting meats and fish, meat and poultry and fish to 6 ounces a day. Fish, I would go with more. I think you can eat more fish, and you should eat more fish. So if you're eating fish, I wouldn't worry too much about limiting the amount unless it's fried, from Long John Silver's, or any fried fish is going to add fat. But a lot of times, deep fried foods have a lot of trans fat in them, so you want to be careful of that. And then low-fat or non-fat dairy products, even fat-free half and half can be substituted for cream in some things. Fat-free milk or 1% milk, yogurt, and then the cream cheeses, sour cream, stuff like that. Being careful of that. Buying lower fat products or substituting. I always use plain yogurt instead of sour cream, and it works, plain non-fat yogurt, and it works fine. Oh, and that's it. One other thing that I wanted to mention when you're trying to think about overall eating for heart health, 2 things, and also for weight management. The size of your plate is important, and we tend to have big plates. So when you go to a restaurant, you get big plates. This is a good size for a plate. So if your plates are a lot bigger than that, you want to think about maybe switching to a smaller plate, because when they've done studies showing that when your plate's smaller, you eat less. When people have less food in front of them, they will eat less. When they have more food in front of them, they'll eat more. So, and you're probably of the mindset, as I am, most people are, that if it's there, you need to clean your plate because you don't want to waste food, right? You were brought up that way, right?
Of course.
Yeah. So the other thing about this that's important is looking at the proportions there. You see the meat is a small part of the plate, the grains, and hopefully that would be whole grains most of the time. And then the fruit and vegetables, this has raspberries, oranges, and lettuce, and it's a mixture of fruit and vegetables, is taking well of half the plate. So that is what you want to think about on your plate and think about in your entire diet. Things should be in that proportion.